Ophthalmology is among the oldest branches of medicine. From clay tablets and temple scrolls to lasers and microsurgery, the story of how we learn to see the eye and save sight stretches across millennia. In the next few minutes, we'll follow the key milestones that shaped modern eye care. Here's some information about me, and I'm glad to have you in my course, from basic to LASIK. Let's begin from the very start. In ancient Mesopotamia, medicine and law met on the same tablet. The Code of Hammurabi doesn't just list prices, it regulates eye surgery and outcomes. A successful operation earned the surgeon a reward. Harm to the eye could bring severe penalties, showing how high the stakes were. Eye disease was often framed as divine punishment, so healing blended ritual, prayer, and practical remedies. Priests and physicians worked side by side, and the eye already stood out as an organ where skill, risk, and social justice were publicly debated. Egyptian physicians left us one of the richest medical records in the Ebers Papyrus. They catalogued ocular complaints, from conjunctival irritation to corneal spots, and prescribed honey, resins, fats, and copper salts as antiseptics and anti-inflammatories. Kohl wasn't just makeup, it likely offered UV and infection protection around the eyelids. Importantly, they described eyelid procedures and wound care, early moves toward operative ophthalmology, along with structured diagnosis by signs, discharge color, pain, photophobia, that reads like the first ophthalmic exam notes. In India, Sushruta compiled a surgical textbook with entire sections on eye disease and operations. He recognized cataract as an opacity of the lens and described couching, displacing the opaque lens with a fine instrument while stressing patient positioning, asepsis for the era, and aftercare. He differentiated external disorders, lids, conjunctiva, from deeper diseases, and linked surgical indication to visual function, not just appearance. Technique, instruments, preparation, and complications are laid out methodically, a template future cataract surgery would refine. In Hellenistic Alexandria, Herophilus advanced anatomy by systematic human dissection. He distinguished nerves from tendons, traced the optic nerve to the brain, and described structures of the eye, including retina and vitreous, building a map that clinicians could finally trust. The Alexandrian approach, observe, dissect, compare, turned the eye from a philosophical puzzle into a real organ with parts and pathways, setting the stage for correlating structure with function. Roman scholar Aulus Cornelius Celsus in De Medicina, also De Re Medica, codified practical eye care, managing trichiasis, entropion, and pterygium with incision, eversion, cautery, bandaging, plus strict hygiene and aftercare. Crucially, he preserved Greek surgical knowledge and passed on clear, stepwise methods for later physicians. From the 9th to 13th centuries, scholars in the Islamic world reshaped both optics and clinical eye care. Ibn al-Haytham al-Hazan proved that light enters the eye from objects, overturning eye-beam theories and establishing experimental optics with camera obscurate tests, refraction studies, and a demand for evidence. Clinically, authors like Hunayn ibn Ishaq wrote comprehensive treatises on the eye. Surgeons such as Ammar al-Mawsili described hollow needle cataract aspiration, and al-Zawrawi detailed specialized instruments. The result: precise anatomy, indications, and tools that made ophthalmology a technical specialty. In 1583, German surgeon Georg Bartisch published Ophthalmoduleia Augendienst, a lavishly illustrated manual uniting anatomy, diseases, surgery, and prosthetics. His flapped woodcuts let readers peel back layers of the eye, a 16th century AR experience. He included practical guidance on strabismus, lid surgery, injuries, and ocular prostheses. Beyond pictures, Bartisch argued for hands-on skill and careful patient observation, giving practitioners a visual language to standardize practice. The 19th century turned observation into science. In 1851, Hermann von Helmholtz invented the direct ophthalmoscope, letting doctors see the living retina, vessels, optic disc, and pathology. Soon, Donders clarified refractive errors, Snellen standardized visual acuity charts, and Ruete developed indirect ophthalmoscopy. New microscopes and pathology connected retinal signs to systemic disease. Specialized clinics and training programs professionalized the field. Ophthalmology became a model for objective measurement in medicine. The surgical revolution arrived in stages. In 1949, Harold Ridley implanted the first intraocular lens, PMAA, inspired by aircraft canopy plastic, launching the IOL era despite early skepticism. In 1967, Charles Kellman with Anton Banco introduced phacoemulsification using ultrasound to emulsify the lens through a tiny incision, enabling faster healing and astigmatism control. Operating microscopes, slit lamp biomicroscopy, and cryotherapy transformed technique. Vitrectomy opened the posterior segment, and retinal photocoagulation evolved into modern laser therapy. By century's end, imaging and microsurgery made ophthalmology one of medicine's safest, most precise surgical specialties. Across Soviet and later Russian ophthalmology, several pioneers changed global practice. Vladimir Filatov advanced corneal transplantation and corneal tissue preservation, laying the groundwork for modern keratoplasty. Sviatoslav Fyodorov popularized radial keratotomy, the first widely adopted refractive surgery for myopia, opening the door to later laser procedures. Mikhail Krasnov developed early laser techniques for glaucoma, helping introduce treatment of aqueous outflow pathways. Together, these advances linked surgical innovation with large-scale clinical practice. From clay tablets to precision optics, from herbal salves to ultrasound and lasers, ophthalmology is a story of observation, experiment, and compassion. We stand on the shoulders of generations who turned curiosity into sight saved, and the next chapter is still being written. Thanks for watching. I hope you enjoyed the video. Check out the next one, and if you found this useful, please like the video and subscribe to the channel.